Hey everybody, this is Dr. Langdon, board certified pediatrician, fellow of the American Academy of Pediatrics. I'm a mother to 6 adult children and now 3 grandchildren. I'm a grandmother too. And today's video is hopefully to explain a lot of recent questions and to bring a voice of reason and calm after a rather disturbing press conference that occurred 2 days ago. Today's Wednesday, September 24th, 2025, and many concerns were raised by this press conference regarding acetaminophen causing autism when acetaminophen had been taken by a pregnant mom before delivery. Now, there are so many points I hope to make on this video. I hope they make sense to you. I am open to questions, but not open to ugly or mean debate. I want to share with you some science and what I believe to be common sense, and also some consensus feelings from multiple professional organizations in America. Now, first, let me give you a wee bit of a timeline. The ingredient acetaminophen was developed in the late 1800s, but it was not marketed or prescribed. It was originally prescription to children as a liquid suspension until 1955. Back in 1911, schizophrenia was differentiated from autism, but then it was closer to around 1943 when autism was used as a specific diagnosis. Now, one of the important things to remember in this whole discussion is that autism is not new. I saw a post today from supposedly a healthcare professional who said that autism was new. You guys, it's not new. We diagnose it more now for a host of reasons. Shall I explain those reasons to you? Part of it is that we're much more aware of it. Parents are more aware of it. We hope and pray that there's less stigma around it so that the parents are willing to get an evaluation done. Beginning in 2007, the American Academy of Pediatrics, who I follow their guidelines and recommendations, recommended that we start doing screening tests in children at the 18-month well visit and the 2-year-old or 24-month-old well child check. We do that with a validated screening tool called the Modified Checklist for Autism in Toddlers, or MCHAT. And because we're screening every single child, of course, we're going to find more kids who have red flags for having autism. And then the reason this is good is because we know that early intervention improves outcomes. So when we screen more kids and more frequently, we're going to find more that have it. And this isn't a bad thing. This is a good thing because then they can get the supports that they need. And that's what we are all about. Inclusive care, helping children who are neurodivergent achieve their full potential. So, if you have been hearing on the internet that there's so much more autism now, not necessarily. The other thing that happened is in 2013, the criteria for diagnosis changed. So diagnostic criteria, we call that, changed, and included a lot of other subtypes or other autism adjacent things, and now they're all lumped into the same category of autism, and we really call it autism spectrum disorder, or ASD, not to be confused with atrial septal defect. You know how we love to have mnemonics that mean 2 different things. So there are a lot of factors here. An additional factor is that as we screen more and parents are more willing to get the full diagnostic evaluation done and we get more kids with it and we provide more supports, these children are doing very well and grow up to be fabulous adults who are contributing to society, who have their own relationships, get married, have children, etc. Well, science can explain up to 85% of cases by genetic purposes, reasons, background, explanations. And so if we already know that 85% of cases are explained by genetics, and we know now that children are doing better who are diagnosed and receive early support and go on to have fulfilling lives and having kids of their own, well, there are more genes in the pool for making that next generation of kids who could be neurodivergent. And we embrace that. Part of the frustration of what happened 2 days ago is that it felt like a lot of blame being dumped on moms. You moms out there, you rock. You're amazing. You love your children who are neurodivergent, and this is not your fault. And those children are beautiful and bring a lot to the table and a lot to add to the richness and diversity of our lives and our culture. So that was somewhat offensive to me, being a physician who takes care of folks who are on the spectrum. So just know that this blaming of mothers is not new. In the past, autism itself was blamed on having a refrigerator mom, which was a mom who was not as emotionally available or who was cold to the child. And so isn't it just amazing that we are still blaming moms after all these years instead of relying on the science? Now, here's the tricky thing about science. In real science, you can't say, oh, I know you scientists have been sciencing these many decades to explain etiology, treatment, evaluation, diagnosis of autism. But you know what? We're going to set a deadline on our science and boom, we got an answer, we got a treatment, we got it all figured out. You guys, that's just simply not how science works. And so let me explain a little bit about what's happened with the confusion here. There have been several studies that showed a possible correlation with acetaminophen use in pregnancy and increased risk of autism in the kids. Here's the thing. Many of these studies had confounding factors that were not controlled for. Many of these studies had a very low N or sample size. So the one that was quoted recently was a Mount Sinai Harvard study, and it was not fantastic, and it did not control for confounding factors. And so the one that a lot of the professional societies are using was the one published in JAMA in April of 2024 out of Sweden that had 2.5 million children that controlled for siblings, families, confounding factors, and shocker, the association fell out. Here's the biggest headline, you guys. Even if one of these studies did show an association, correlation is not causation. Do you understand? You could say the rates of avocado sales correlate exactly precisely, and they actually do, with the rates of autism diagnosis. But it has nothing to do with causation. Correlation is as ice cream sales go up, shark attacks go up, or vice versa. Correlation does not mean causation. That is super important to remember here, you guys. So one of the other things that just strikes me is that how if you had an individual healthcare provider, they would say, oh, you know what? I don't trust the American Academy of Pediatrics, over 67,000 pediatricians. I don't trust the American College of Obstetrics and Gynecology. I don't trust the American Academy of Family Physicians. I don't trust the American Psychiatric Association. So little old me, I'm going to do my individual personal research without a PhD in statistics or a PhD in epidemiology or a PhD in all the other things, immunology, population health, public health. But I'm just going to, I'll just thumb through a few of these studies and declare my results. Like that's not how it works, guys. And so I think that when you have all of the professional societies of physicians in complete agreement about this one question, does acetaminophen in pregnancy cause autism? And we have all come out, all the professional societies, including AAP and ACOG, to say, no, there is not causation of acetaminophen in autism. When we have a good, well-conducted study in which confounding factors are controlled, there's no association. Can you see that? The other thing I think has been missed in all this is that, guess what? A maternal fever during pregnancy is dangerous. In the first trimester, it could cause neural tube defects, congenital heart disease, cleft lip and palate, all kinds of things. Further along in the pregnancy, it could cause premature labor, premature deliveries, outright miscarriages. So just opting not to treat maternal fever in pregnancy, wildly dangerous. It's not a matter of tough it out, as was said in the press conference. That's insane. People can say this who aren't actually physicians because they won't get sued for malpractice for making up this absolutely inaccurate medical advice. That's not cool. So we who are actual physicians have to be extremely careful what we say or recommend because we represent science and we care about patients and we care about patient outcomes. So I know that was a lot of information. I've also been asked, how can lay people just read the studies for themselves? You can, but I can tell you it's very tricky and maybe take a statistics course or two to understand it better. I personally really like my professional society, the American Academy of Pediatrics, and when we come out with a giant policy statement, it's usually right, and I usually understand the science behind it and the data, and I will check just to make sure, but in this case, I absolutely do. Now, at that same press conference, there were some completely inaccurate, just out of the blue, wild statements made about vaccines, which didn't even have any relevance to the talk, but again, very dangerous, increased vaccine hesitancy, and I will make another video to address that. Safe to say, we aren't giving horse doses of vaccines. Kids aren't getting 80 shots in childhood. I don't know where the numbers or the analogies came from, but none of that was accurate. So please be careful where you're getting your information. Find a trusted professional healthcare provider and listen to them. When the entire professional society agrees on something, it's probably right. I hope this answered some of your questions. And again, happy to engage in discussion, but not mean or angry debate. Thanks.